Next, we'd like to present a very important theme in our work, which is resilience. Based on the discussions we've had so far, especially in the first panel, where we explored how a right to belong is being violated all around the world, one thing is clear: we will need more, not less attention on compassion and care. We will need to foster more solidarity amongst people. We will need more participatory and cooperative systems of exchange and governance. And we will need more community-based initiatives that work from the grassroots up, not from the top down. All of this takes imagination and determination. It demands our resilience. Much of the literature on resilience, especially resilience that we call collective resilience, highlights the important role that social capital and networks play in bolstering individual and groups. In challenging times, people feel compelled to come together to share resources and to improve the connectivity of community so that people can pull through the crisis together. The work of the Samuel Center for Social Connectedness and the Samuel Family Foundation is a collection of varied examples and rich stories that demonstrate that a bank of resilience already exists. People in many parts of the world have come up with very practical, very effective ways of combating social isolation and building connectedness in communities large and small. In so doing, they have contributed stock to the bank of resilience. And the more the rest of the world knows of it, I would call it time banking plus, the greater amount of stock that can be added and indeed withdrawn. Reciprocity is the most important policy of this bank. To illustrate the work of building resilience, I'm going to call on Marlene Ogawa, Acting Country Director for Synergos South Africa, and then I think we'll then open to questions for both of you.
Thanks, Kim. Hi, everyone. So I have to say, when I Googled Bank of Resilience, what I came across was a lot of how to strengthen the financial sector and those kind of, how to avoid 2008. But for me, Bank of Resilience is really about what we put in to what we want to get out. And it's built from the inside out. I work with an organization called Synergos Institute, and have been blessed and such a gift to run the Social Connectedness program. This program works with South African partners and across the SADC region, looking at organizations and what they're already doing, and then how to strengthen that through social connectedness. What we found was that a lot of these organizations are focused so much on addressing the material needs of children, but not enough spent on the emotional, psychosocial support. And so what we do is, we call it institutionalization of social connectedness, is we work with these organizations to understand why connectedness is so important and understand why we have to focus on the relational aspects and not so much around the material aspects of what children, what young people, what our communities need. So you will hear later some of our models of change from our partners, and generally it's really, we focus on working at multiple layers within organizations, within networks. And the gift of the work has also been how it shifts organizations from the staff to the people they work with, and how it shifts their levels of strength and resilience and agency as well. Agency for us is really important because it really gives people voice in communities where often they feel voiceless. So having dialogues and conversations with parents, with caregivers, with care workers around what and how to connect to your child so that you have a different conversation. And yes, there are cultural practices. We don't talk about sex, we don't talk about birth control, but in our society where so many young people are dying of HIV/AIDS, we need to shift those cultural practices. And also, what are the harmful practices? So we've learned a lot about indigenous knowledge systems and practices that are harmful and also beneficial. And one of the things that when I think about resilience is really what Aaron was doing is around the tree, a tree grounds us in our roots, and we know how and where we stand. And a tree, if we are strong in our roots and our culture and recognize and embrace it and know who we are, then it allows us to grow and stretch out. But we are always grounded in that strength. And what we are trying to remind children, young people, care workers, families about is what's your grounding, and how when the winds and the weather sways you, you still stand strong. So for us, that's resilience and how you bank into yourself. One of the biggest things that I'm learning as well, and I'm just going to ask you a question, is how do you take care of yourself? How do you, and what helps you to connect to yourself? What grounds you? Because it's what grounds us that helps us to bank into ourselves and get returns in a way that we can give. We can only give from what's overflowing. And for me, it's very important for us to understand resilience from that point of view. The work that we do is hard. We see a lot of hardship, a lot of sadness. But if we don't invest in ourselves, and if there's anything other than making a friend that you take away from this gathering, is really self-care. I see it with myself, and I see it with those around me. And so my question to you is, if you have to think of a time when you felt you belonged, where you felt connected to self and those around you, what was that time? Who helped you to feel that sense of connectedness, that sense of belonging? And then only when we are strong and we have that sense of joy that helps us to belong, then we can give to others. And so that's my message to you and to the care workers that I work with on a daily basis and practitioners. Thank you.
Thank you. Before we bring up our next panelist, I just wanted to acknowledge that and thank Marlene again for being one of the guest teachers in my course, with a lot of very lucky students to have had both of you 2 years in a row, and that I remember that was the question that you asked students who were starting to learn, now they're experts, but to learn what this field was all about that we're creating together, and what is social isolation, and what is this lack of belonging. And you asked people to actually look at it. It's where we got the idea for today, actually, to look at a tree and to look at your life that way, and to understand what your internal grounding and sense of self is. With the Bank of Resilience, what we're also starting to explore with all of you here is that what happens when you could be the most resilient person on the planet, but sometimes you're just low, or you've just been pounded down too many times, or something awful's happened in your family, and you're most concerned at the hospital with getting the care for your family member, while administrators are saying, well, we won't treat your family member. And so the idea of the bank goes to my basic belief is that we all are of equal value. And so for some people, the gift they may be able to give is their listening and their time. And for others, it can be any number of things, but all these gifts are equal. But it's something that Albert brought very clearly to all of us this morning, and others, to ask us to think about what it feels like when you bring your gifts and they aren't received. So the other side of this is knowing that your gift is being received. I got to interview Margaret Atwood about a year ago for the same book, and she said to me, Kim, the gift always has to keep moving. And that's also one of the seeds for this Bank of Reciprocity. We call each other soul sisters. That's very intentional, and I think of both of you that way. Thank you very much. Don't go. I'm now going to bring one more amazing panelist, 3 great panelists here, to the stage. And this is Basimenye Shima, who we know as Sime. She is the director of Partners in Health, the Community Health Director in Malawi. Welcome. And I'd also ask Vino to come back up and join me because you're still part of this. And I'm going to be asking you to help me when it's time to moderate questions. Thank you. Welcome, Sime.
All right, so thank you so much, Kim, and the entire organizing committee for inviting me all the way from Malawi, Africa. It's such an honor and a great opportunity to be with everyone here. So I am here, as you've already Kim introducing me. My name is Basimenye Nhlema. I come from Malawi and I work with Partners in Health in the Department of Community Health. So I'm here basically to quickly share with you the work that we are doing and how it relates to the concept of resilience. I don't want to complicate my thoughts. I've come too far, so allow me to use my notes. So basically, before I can begin to share the work that we do, I would want to give you a brief context of where we are and some of the issues that we are having to deal with so you can understand where we are coming from. So basically, Malawi is a landlocked country and we're about 18 million people, and about 85% of the population live in rural areas where Partners in Health is working. And in Neno, the district where we are in, the population about 170,000 people, most of them subsistence farmers and living pretty much a very poor community and living on less than $1 on a day. And where we are, there's pretty much no access using tarmac roads to any of the places that we have to go to. So you can imagine that the basic right to health is compromised by lack of simple things as a road. So on a day-to-day basis, it is a very difficult situation where when mothers want to access health services, for instance, it is very difficult. If the elderly people want to access or any other services, it is very difficult for them to travel because literally most of the travel you have to do it by foot. So this is the context where I'm coming from. We still have HIV prevalence rate very high, issues of maternal mortality, child health related issues. They are a huge public health concern where I come from. So basically as an organization, our work is to support the Ministry of Health in terms of providing clinical care. But then we looked at, in as much as yes, we could be supporting facilities, we could be providing medicines and personnel, but how can we leverage the resources that we have in the community so that we are providing more care that is not just clinical in nature? So this is where we came with the concept which we call the household model, where basically we looked at the community and saw that already within the community there is a resource of where people have a sense of community. Back home, when someone has a catastrophe that has happened, they've lost someone, the entire community will come to console that person. You don't have to know the person who's passed on. You don't have to know the person who is sick, but if they are sick, they deserve support from everyone else. So we felt, how could we use these communal resources for health outcomes? So we came up with a program where we've enrolled, with the support of Samuel Family Foundation, we have an army of community health workers who are attached to households. So on a daily basis, these people, they are visiting patients, they are visiting vulnerable households that maybe have mental ill patients. There are those households with the older people, patients like maybe epilepsy and all that. They are visiting these people to provide support, to monitor them in terms of how are they getting their medication. If they are missing hospital appointments, they accompany them to the facility and help them to navigate the system. Because sometimes, for instance, instance, for a mentally ill person, you may provide them with an appointment, but it will be difficult for them to actually go to the facility and find where the service is. So basically having someone who walks with them to the facility, it's long distances, so it also provides that support basically to the individuals to walk with them, go to the facility, access all the services that they need, and then they bring them back home. We also provide some economic accompaniment, because as we've said, the majority of the population is largely poor. So sometimes you have someone who is on treatment, but they don't have enough food to go with that treatment. So equally, you would need to provide something for them that can support them as they are undergoing their treatment. So basically, these are some of the things that we are doing and trying to build that ability for people to cope with the situations that they are going through. Thank you.
Thank you very much. Thanks. You know, the word that comes up a lot for me in all of your remarks is dignity, and the importance of restoring and revering one's own dignity, but also, especially so, the dignity of people that we use words like we're the caregiver too, we're caring for someone. We don't use the victim language at all. Not that people aren't victims, but if you leave someone a victim, then they never get their power back. And when you talked, Basimenye, about the accompaniment model of Partners in Health, the way that someone goes with someone, often physically, to give them support. It's really the same support that we would want ourselves in return. And I think it's really important to understand the reciprocity in this. The other thing that I wanted to mention is a term that I learned from the founder of PIH, Dr. Paul Farmer. He talks about, and you talk about, and Mark talks about the hermeneutic of generosity, which I call the H of G, which really means that we should give everyone the benefit of the doubt. And I see that in all three of you. You bless the organizations that you're part of. You could be almost anywhere, and I think you would be doing the same kind of work. I really do, but always with dignity and always with this generous spirit. So I just wanted to highlight that as we're thinking through together what reciprocity means and what the idea of a bank of resilience means. We've got about 15 minutes for Q&A, and I wanted to see if my colleague on the panel had anything to ask. I hope you do, and then we'll go into questions.
So I guess I would ask you, you were talking about self-care earlier, and I think that's an important aspect of this Bank of Resilience because, of course, we ask ourselves, how can we support one another? But like you said, really difficult to do that when you're wearing yourself thin. And I think that people sometimes are resilient because they have to be, and then I think long term there can be like very harmful effects of that kind of keeping it together. So like, how would you support somebody that is in this caring capacity that needs to kind of stop and care for themselves, and how can you maybe as like a third party advocate for that to offer supports?
That's an awesome question, right? And I'm going to ask each of you if I can just take it just a sentence farther, which is, how do you care for the caregiver?
Yes. I think one of the things that we've learned through the work, and what I see is as well, is, and we learn it through children, relational support is a skill that you build over time. And for care workers and caregivers, it is about learning how to care for each other. And one of the things that we see is that we forget that we are a resource to each other. So we do a lot of peer support and linking people. We call it a buddy system at times, just to raise that awareness around there is someone who cares. And that that caring and reaching out and asking for help takes work, and we're not all able to. But so what we emphasize and what we try to create in these organizations is peer support, peer care, and then also storytelling and talking about the things that you're struggling with and the challenges, both at a personal level, which is linked to our vulnerability and authenticity, but then also how do we support each other? Because often we come with a facade and we carry so much. And so what's the space that our organizations, where we are at, allow, within our personal life as well, allow the space to genuinely talk to each other. So that's at the different levels that size, and allow people to tell their stories, because often they don't tell anyone their life stories. And that in and of itself is part of the beginning of a process of healing for them. So we talk about the wounded healer, because they heal others, but they wounded as well. So it's a cycle of support that we need to focus on to care for each other. Yes.
Thank you so much. It's a really important question. How do we care for the caregiver? You'll see, like in our context where our community health workers are there providing support to their fellow community members. They themselves don't have much. The situation that I described here is the same for them. They are living on $1 per day. They are afflicted by the same diseases that they are supporting their friends with. So they are equally burdened by the same things and situations that their fellow community members are going through. So pretty much to what she's talked about, peer support. So basically they have also created a community of their own as community health workers. So when they meet, they talk about the situations that they meet in their work, but also talk about their own personal things that they are going through. So on a daily basis, on a regular basis, they are debriefing, talking about these things, because they also belong to the same community. Yeah.
Talking about caring for someone, my mother, when she took sick, I come from a big family and everybody had to work and everyone had their excuse, they had cars. I was cleaning houses, and I would get up in the morning and go clean the house, and the first thing I'd do was run out to the York Hospital and sit with my mother. And for the average person, they had to leave the hospital at 8 o'clock, but I was allowed to sit as long as I wanted. And I had a friend, a small community, and it came back from my friends at Special Olympics. They were telling me, Loretta, you need to give yourself a break. Sometimes the caregiver gives so much of themselves, they don't have nothing left. It's like the giving tree. It's a little book that they've written about a tree that gave and gave and gave until it ran out. And that's what was happening to me, because I did not want my mother to end up leaving this earth and nobody knowing about her. So every day I would run on the highway. And if I had my bike and it didn't have a flat, I would be out to that nursing home. And I had to be resilient, because when I walked in that room and if I smelled something that wasn't right, I said, I'm not liking this. And I would be right there. And one of the ladies at the nursing home says, you're out here every day for the last 4 years. I said, you darn tootin'. Because I care, because that same mother was told that I wouldn't be able to do anything. I was with her until the day she died. And sometimes it just takes a small community of people and say, Loretta, you need to take a break. And it was Special Olympics says, Loretta, we want you to go to state games because you need a break. But I worried. How was my mom going to be for that next 3 days? And I did go to those state games because I knew that somebody was going to be there to vouch for my mother. So sometimes you can give too much. But if you really care about something you love, there's never too much. And I loved my mother.
Thank you. I would also posit that caregivers need caregivers too. We're now going to open up. We've got about 7.5 minutes for questions, and I guess I'll just keep my microphone and stand up. And
Hi, my name is Nhlema Kasule from Uganda, living in Boston. I run SEDA International in Uganda, looking at girls' employment and women's empowerment. I just wanted to turn the conversation a little bit from the Bank of Resilience to the analogy of growing a tree and building a forest. Because I'm saying this because there are many, apart from social isolation is not something you can easily measure and identify. How can we include other people who may not necessarily be the ones we think are isolated? Giving a specific example, women leaders who are lonely at their workplaces, like CEOs. Powerful women who put on this good makeup and stand in front of you when inside they are dying. How can we include such people in this conversation? And lastly, how can we include more people from the private sector so that this is not a conversation of civil society and people who are working with communities? How can we bring in those other people? Thank you.
Yeah, I'll try. Some of what's happening in South Africa is there's a psychosocial support framework, and part of our work with REPSI, which is a regional psychosocial support initiative, is working on looking at psychosocial policies and frameworks and guidelines. And what it's beginning to do is, yes, within support for children and families, but there's a growing conversation around well-being and well-being within the workplace and relational well-being and how we relate and how that helps. And I'm excited. I think the Ministry of Loneliness is here from the UK, and I think they have studies that will show and you know, how to measure and track the impact of people being lonely, going into depression and all kinds of mental health challenges. And so I think it's for economists, governments, for corporates to realize the impact that it has, because it doesn't only happen in those spaces, but in other spaces as well. It's happening in society. So it's a societal issue.
Yeah. Laurence?
Yeah, I just wanted to share a reflection also.
And if you could tell us who you are.
Yes. My name is Laurence Deschamps-Laporte. I work for the government of Canada. Just wanted to share a personal reflection, kind of inspired by what Loretta's story, but also inspired by hearing about your relationship with your sister Debbie, and also observing Nisreen and Nujeen in the back, just the most loving sisterhood all around this space, really inspiring. So I worked for a poverty institute that is well represented here with Kim, and while I've always been passionate about international relations and foreign affairs, I think Kim really helped me make the connection between my personal journey and my life and this passion for international affairs by bringing in this component of social isolation. I grew up with a sister with autism. The analogy for people with autism that always most got under my skin is them being described as people in a bubble. Or at first in the 90s, people thought there was a problem with audition. They couldn't hear. Maybe it's because it sounds similar. But the reality about people with autism is not that they are in a bubble. We are the ones in a bubble. They are so raw, they haven't learned our unhelpful mechanism of distancing ourselves from others. They feel everything, they sense everything, they are open to the world, and that's why it is so difficult, perhaps, because they are not surrounded by a society like them. And I have learned the most in my life by being surrounded with this community, probably more than during my PhD, which I'm sad to say, but if we could unlearn our barriers and be a little bit more sensitive, just like these people, this might be a solution to connect us. Thank you.
Thanks, Laurence.
From my personal experiences as an Aboriginal person, in all social programming, whether it's law or health, why is it so easy to tolerate that if I commit an offense, that I am automatically guilty until proven innocent, which is just the opposite. Now, as an Aboriginal person, why is it tolerated that there is actually a big discrepancy for the kind of a healthcare service I will get compared to someone else. So my question is, how can we collectively not just suggest, but also make sure that compassion will be our overall objective, no matter what treatment or what help we need to every individual. So that's the thing that I'm really hoping that one day soon, that compassion will be our overall objective.
Well, I didn't think it was a question, but just want to echo your sentiments to say, unfortunately, we live in a world that defines us differently, where other people, other communities have more rights to belong or to have access to certain amenities as compared to other people. But just to agree with you, and also in line with the philosophy of Partners in Health, where every person is equal and they deserve similar rights and access to health, because the pain that you feel as an Aboriginal man and elder is the same pain that an elder in my community back home in Africa feels. It's the same hunger, it's the same poverty. We all go through the same challenges, even though in our different contexts. So we do hope and pray that over time, as many of us are coming forward to have discussions, to have forums like these, where forums that are inclusive enough to bring in everyone, irrespective of how they stand in society. She talked about women CEOs who are suffering in silence, and yet externally you see they've got everything they require in the world, but they are not happy, they are isolated. So we hope and pray for a world one day where we can all come together and have access to the same things that every human being should have access to.
Amen. That was such an important point and word, compassion, that Loretta's going to respond to, and then we'll go to the last question.
I'd just like to say that there are over 200 million people in the world with intellectual disability. And the persons that get the least of health care are those with intellectual disability, who might be in an apartment by themselves and don't know how to get to that health care. We at Special Olympics make sure that we have a big games or a screening. It's amazing that we see people come in who never had their teeth checked, and maybe that's the problems that they're having, or never had their eyes checked or their feet. And it's simple health care. We're not talking about major surgeries, just to get the simple health care such as taking care of yourself. My mother lost all her teeth by the time I was in high school. I still today at 66 have most of my teeth, and I'm getting ready to get a surgery. I am able to provide that myself. But there are a lot of my fellow athletes who do not have good health care at all. And we talk about Special Olympics, we don't only talk about sport. We talk about social well-being of the person. We talk about health care and how it's impacted people with intellectual disability. And it's the biggest discrepancy in the world is people with intellectual disability getting the least of health care.
And we'll now go to Barbara, the last question.
Thank you. My name is Babur Bashir, and I am from Pakistan. I am also a fellow of Synergos. So my question is basically from my fellow from Synergos, basically, because we have been doing a lot of work in Pakistan on psychosocial support. So one of the questions that we ourselves asked to ourselves, like before any kind of interventions into the community on psychosocial support, the communities have been there and they have been resilient. So they have been using whatsoever the indigenous tools and mechanism to deal with the situations. So when we intervene as someone outsiders, so to what extent really we take into account that mechanism that are already there. Secondly, because of this, since there is a kind of power relation between we go to the communities and the ones we want to serve, basically. And in that power relationship, what kind of accountability mechanisms we have towards the community, basically?
Thanks, Babar. I'll speak, and some of what we've learned is to listen to communities and some of the challenges that they might have. And what we're finding is that they are quite innovative and creative. I think where we are at in a lot of communities is that they don't come together to have those conversations anymore. There's no town hall community conversations, there's no dialogues that happen on a regular basis. The times nowadays when, I know in South Africa a lot of the times when people come together is to protest against government services and those challenges. And we work with the Center for the Study of Resilience, and they would say communities voice, and then they get violence, and they get vandalized, and so all these different v's that communities do, and so it is because they don't talk. They don't have spaces to talk. So what we encourage with our local partners is to create those spaces for community dialogues, for circles of care and support where caregivers come together, and to hear from them what the issues are and how they can address it without the support of even the organization, and how to set up and reset up some of what was there, because we do recognize that a lot of it has fallen apart. So how we approach it is always to listen to communities and to allow them to come up with and innovate around what solutions, and not to give. Because we've learned also, whether it's the child support grant and other social protection interventions, it helps, but often it disempowers certain people in the community. So to be more inclusive around the conversations before interventions happen, that's also what we are learning around that. Yeah, thanks.
I may just ask Sime if you had anything to add to the second part, to address the second part, which is accountability. How do you ensure accountability?
Basically, bringing in the community, as the community is part and is participating in the solution, but also bringing the community so that they can review, they can relook at their own levels of participation and see how they are being a solution to the challenges that they are facing.
Almost a shift, isn't it, in the way most research is conducted, not research based on indigenous research principles, but all the rest of it is that the community is the one that's being measured. The community has metrics set for them by others, and the community has to literally measure up. And what I think you're saying, and what I think some others might agree with, is that that's all wrong, is that the community should set the metrics, the community owns the research. And in collaborative partnership, everyone measures up.
And can I just add, Kim, when we did the indigenous knowledge systems, the Imbeleko research in parts of Southern Africa, one of the things that Kim really pushed us to do is to go back into the communities, give feedback. And what was so helpful, especially in Mozambique and some of the other areas, was the community's reflection. Actually, these are the cultural practices that help you to connect to each other. And these are the cultural practices that are eroding. And so part of the conversation post the research was, how do we bring some of those back, and how do we have conversations around whether young people are practicing do cultural and traditional practices, and what's the teaching and learning that's intergenerational, and also what are the harmful practices. So it was a very helpful process that helped communities to shift and embrace and recognize what's happening and not. And that's the gift of giving feedback back into communities.
Thanks. I just wanted to ask Loretta something based on that, which is that Bill Alford, who we know is our former, well, you know him as advocating for the right to belong, which is awesome. We know him as our fellow board member of Special Olympics International. And one of the things that he and I have been talking about, and I got to talk about when I was there visiting earlier in the year, was about research on about people with ID really needs to be being conducted by people with ID. And that's something that I think that all of you from the academy, from universities here today, could work on us with. And I just wondered, Loretta, how you thought about that, because I think that's what has to happen.
It's just like the community. I mean, how can you bring somebody outside the community and tell your people how they live or what's their culture? It'll be like me going to the indigenous community, which I stayed for 6 weeks in 1987. It would be like me going there and telling them what it's like in the United States. No, I should be going there to learn what it's like in their community. They're the ones who should be leading. And it's the same way with our community. It shouldn't be done by the people who run Special Olympics. It should be done by us athletes. And in Special Olympics, we do have athlete leadership programs where we are training athletes to come with the issues of their communities across the northern United States and across the world and find out what their issues are so that they can take it back to their communities and say, hey, look, this is what's going on here. That person goes back to their community. So it's like the without us or for us without us, nothing for us without us.
Nothing about us without us.
That's
yeah.
all came from the disabilities group years ago. And that's the same way we think. And us athletes should have an intake of what happens in our community of people with intellectual disability. It could be across the globe, like in the UAE, people of determination.
Yeah.
So I think we as a group of people should have the same stake and the right. We're the ones who have to live with the disability. But I always say to people all the time, I don't let my disability define who I am.
I am now going to pass to my colleague, Veena Landry, who is going to bring us to a close.
Okay, so this has been a fascinating conversation to have. You guys are obviously all amazing sitting here next to me. And this is also an interesting space because although we may not be like all caregivers in the traditional sense, like we are all assembled here to talk about how to foster and grow a movement. And it's like kind of an interesting sample group because we're all here to talk about social connection and overcoming isolation. So it's a good time to kind of look around and make sure that like this is a community as well and are all of our needs met. How to care for the caregiver, like how to care for the social connectedness movement person. So coming to a close on this, I was wondering if you ladies had any kind of final takeaways, if there's one thing that you would like this room of people to walk away from this knowing and remembering. Yeah, in a sentence, if possible. I know that's a
we all need each other. We all need to be connected. Because without social connectedness in the human being, what is there? So we all need to be connected to each other in our communities.
Thanks, Ursula. It's such an honor to be next to you and just, I'm in awe at what you do, so thanks. I was sitting and writing, be the belonging and be the connectedness that you want to see in the world. Yeah. So I think that's my, you have to live it and be it to work in it, I think, so, and model it. So I just hope we can grow that amongst ourselves, within ourselves, so that we can give from our full cups. Thanks.
Thank you so much. As I said earlier on, it's been such an honor to be here. I think my last reflections would be each one of us has something to give. If someone who lives under $1 a day can still have something to give to a community, to give hope to someone, I believe each one of us in this room has something that they can give. Thank you.
Thank you.